We will continue with the class on the arterial supply of brain. Now we'll see about the cerebral arteries. As you have studied already, the cerebrum is supplied by the three pairs of cerebral arteries, namely anterior cerebral, middle cerebral and posterior cerebral arteries. So the entire cerebrum is supplied by these three major arteries: anterior, middle and posterior cerebral arteries. Let us see about the branching pattern of these cerebral arteries. The cerebral arteries give three types of branches: cortical branches, central branches and choroidal branches. So the cerebral arteries give three types of branches: cortical, central and choroidal. First we will see about the cortical branches. The cortical arteries supply the outer portion of cerebrum. These cortical arteries freely anastomose and form a network in the pyometer on the surface of the cerebral cortex. From this network, branches arise and pierce the cortex at right angles. And once they enter the cortex, they become end arteries. There are two types of these end arteries. One, short arteries, which confine themselves only to the cerebral cortex, and second, long arteries, which pass through the cortex and reach the outer portion of the white matter. Now we will see about the central arteries. As the name suggests, the central branches are numerous, slender, thin-walled perforating branches which supply the centrally located parts of the cerebrum, like the corpus striatum, internal capsule, etc. These are also end arteries. The central arteries arise in the region of the circle of Willis and are arranged into the following four groups: anteromedial group, anterolateral group, the posteromedial group and the posterolateral group. We will see about the four groups of central arteries in some detail. The anteromedial group. The arteries of the anteromedial group arise from the anterior cerebral and anterior communicating arteries, and they enter through the anterior perforated substance to supply the anterior limb of internal capsule, the corpus striatum and the anterior hypothalamus. The anterolateral group. The central arteries of the anterolateral group are also called as the lateral striate arteries. So these arteries arise from the proximal part of the middle cerebral artery. They also pass through the anterior perforated substance to supply the anterior limb of the internal capsule, the caudate and lentiform nuclei. The posteromedial group. The central arteries of this group arise from the proximal part of the posterior cerebral artery and the adjoining part of the posterior communicating artery. These arteries enter through the posterior perforated substance to supply the thalamus, the subthalamus and the hypothalamus. The posterolateral group. The arteries of this group arise from the posterior cerebral artery after it has curved around the cerebral peduncle. These arteries supply the thalamus, including the geniculate bodies. One of the larger lateral striate branches of the middle cerebral artery, which supply the internal capsule, the caudate and lentiform nuclei, is termed as the Charcot's artery. This artery is clinically important as it is an artery which is most susceptible to rupture and is also termed as the artery of cerebral hemorrhage. The choroidal arteries form a network of capillaries which project into the ventricles after invaginating the layers of pia mater and ependyma and forms the choroid plexuses in the ventricles. There are two major choroidal arteries, the anterior choroidal artery and the posterior choroidal artery. The anterior choroidal artery arises from the internal carotid artery, runs posteriorly near the optic tract, crosses the uncus to enter the choroidal plexus in the inferior horn of the lateral ventricle. The posterior choroidal artery arises from the posterior cerebral artery, encircles around the midbrain to enter the choroid plexus of the third and lateral ventricles through the transverse fissure. We have already seen the arterial supply of the different surfaces of the cerebral hemisphere in our previous class on the cerebrum. Now, here we will just try to reinforce the same concept. The arterial supply of the superolateral surface. Most of the superolateral surface is supplied by the middle cerebral artery. The region of the cerebral cortex supplied includes the greater parts of the primary motor and sensory areas and the frontal eye field. And in the left, that means the dominant hemisphere, the area of supply of middle cerebral artery includes the Broca's and Wernicke's speech areas. A narrow strip of the cortex adjoining the supromedial border up to the parieto-occipital sulcus is supplied by the anterior cerebral artery. The upper parts of the primary motor and sensory areas lie in this region. And a narrow strip along the lower border of the temporal lobe, excluding the temporal pole, and the occipital lobe are supplied by the posterior cerebral artery. The posterior parts of the visual area lie in this area. Coming to the arterial supply of the medial surface, we have seen that most of the medial surface is supplied by the anterior cerebral artery. The region of cerebral cortex supplied by the anterior cerebral artery includes the parts of the motor and sensory areas which lies on the medial surface of the cerebral hemisphere, namely the paracentral lobule, which is concerned with the perineum, leg and the foot. The temporal pole of the temporal lobe is supplied by the middle cerebral artery, whereas the occipital lobe is supplied by the posterior cerebral artery. The area supplied by the occipital lobe includes the visual cortex. Regarding the arterial supply of the inferior surface, most of the inferior surface except the temporal pole is supplied by the posterior cerebral artery. The lateral part of the orbital surface of the frontal lobe and the temporal pole of the temporal lobe are supplied by the middle cerebral artery, whereas the medial part of the orbital surface of the frontal lobe is supplied by the anterior cerebral artery. So just to revise, each surface of the cerebral hemisphere is supplied by the three major arteries, namely the anterior, middle and the posterior cerebral artery. Most of the superlateral surface is supplied by the middle cerebral artery, most of the medial surface by the anterior cerebral artery, and most of the inferior surface by the posterior cerebral arteries. Now we will briefly see about the venous drainage of the brain. The cerebral veins emerge from the brain, traverse the subarachnoid space, pierce the arachnoid matter and the meningeal layer of dura, and drains into the venous sinus. We will see what are the characteristic features of the venous drainage of the brain. The venous return in the brain does not follow the arterial pattern. The veins of the brain are extremely thin-walled due to the absence of the muscular tissue in their walls, and the veins of the brain possess no valves. The veins of the brain run mainly in the subarachnoid space, and the cerebral veins generally enter the dural venous sinuses obliquely against the flow of blood in the sinuses to avoid the possible collapse following an increased intracranial pressure as they are thin-walled. The veins of the brain comprise of cerebral veins, cerebellar veins, and veins of the brainstem. For the time being, we will confine our discussion to the cerebral veins. The cerebral veins are divided into external or superficial veins which drain the external surface of the cerebral hemisphere, and internal or deep cerebral veins which drain the internal regions of the cerebral hemisphere. So, you can see two types of cerebral veins, mainly the external or the superficial cerebral veins and the internal or the deep cerebral veins. We will first see about the external or the superficial cerebral veins. The external cerebral veins drain the surface, that's the cortex of the cerebral hemisphere, and are arranged into three groups, namely superior, middle, and inferior. The external or the superficial cerebral veins are divided into three groups: superior, middle, and inferior. The superior cerebral veins are about 8 to 12 in number and drain the upper parts of the supralateral and the medial surfaces of the cerebral hemisphere. The middle cerebral veins are usually 4 in number, 2 on each side. They are named as a superficial middle cerebral vein and the deep middle cerebral veins. The inferior cerebral veins are many in number, but they are relatively smaller in size. They drain the inferior surface and the lower parts of the medial and the supralateral surfaces of the cerebral hemisphere. Regarding the internal cerebral veins, there are two internal cerebral veins which are located on either side of the midline in the tela choroidea of the third ventricle. We will see about the great cerebral vein. The great cerebral vein, also called as the vein of Galen, is a single vein of about 2 centimeters length. It is formed by the union of the two internal cerebral veins below and behind the splenium of the corpus callosum. The great cerebral vein receives the two basal veins, and after a short backward course, it joins with the inferior sagittal sinus to form the straight sinus. The tributaries of the great cerebral vein include the internal cerebral veins, the basal veins, veins from the colliculae, and veins from the cerebellum, and adjoining parts of the occipital lobes of the cerebrum. Now we will discuss regarding the clinical anatomy. Cerebral angiography. Cerebral angiography is a radiological technique to visualize the blood vessels of the brain. A radio-opaque solution is injected into one of the major arteries supplying the brain, and serial radiographs of the skull are taken. The injection into the common carotid artery or the internal carotid artery, which is called as a carotid angiogram, shows the distribution of the middle and anterior cerebral arteries, whereas an injection into the vertebral artery permits the visualization of the vertebral, basilar and posterior cerebral arteries together with their branches. The cerebral angiography is an invaluable tool in identifying vascular malformations and aneurysms. It also provides useful information about occlusive vascular disease and space-occupying lesions. The most common condition affecting the blood supply of brain is the cerebrovascular accident, also called as the stroke. A cerebrovascular accident or stroke is a rapidly developing loss of brain function due to a disturbance in the blood supply of brain. There are two major causes for a cerebrovascular accident. It can either be due to an ischemia or it can be due to an hemorrhage in which there is a rupture of a blood vessel supplying the brain. A cerebrovascular accident resulting from ischemia is called as an ischemic stroke. It can be due to a atherosclerosis or a thrombosis of a blood vessel, or it can be due to an embolism. The details you will be learning in the clinical classes. A cerebrovascular accident resulting from a rupture of a blood vessel is termed as a hemorrhagic stroke. Now we will see what are the different types of intracranial hemorrhage. The intracranial hemorrhage can be classified into epidural, subdural, subarachnoid and intracerebral. An epidural or extradural hemorrhage is usually due to rupture of the anterior division of the middle meningeal artery. A subdural hemorrhage is due to the tearing of the superior cerebral veins. A subarachnoid hemorrhage usually results from leakage or rupture of a congenital berry aneurysm of the circle of Willis. An intracerebral or cerebral hemorrhage usually results from a rupture of the thin-walled lenticulostriate artery or the Charcot's artery, which is a branch of the middle cerebral artery. We will see regarding the congenital cerebral aneurysms. These occur mostly on the arteries that form the circle of Willis, particularly at or near the junction of two arteries involved in the formation of the circle of Willis. The basic abnormalities in these vessels at these points is the congenital deficiency of the tunica media, especially of the elastic tissue in the arterial wall. And these aneurysms are usually berry-shaped, hence they are commonly termed as berry aneurysms. As you have seen earlier, a rupture or these congenital berry aneurysms can lead to a subarachnoid hemorrhage. The most probable questions you can get from this chapter are: 1. The two major arterial systems that supply the brain, the vertebrobasilar and the carotid systems, and the intracranial branches of the three major arteries: vertebral artery, basilar artery and internal carotid artery. Circle of Willis is also important. the formation, the branches, and the functional significance. You can also get a draw diagram question on the circle of Willis. You have to work on an SDL topic, middle cerebral artery, which can be asked as a short answer question. You have already studied the arterial supply of the superolateral surface of the cerebral hemisphere and try to reinforce with the help of a diagram. The clinical points related to the blood supply of brain we'll discuss more elaborately in our coming class on the PBL of brain. Thank you.